So as a physician, how do you talk to your patients about weight loss? I get this question a lot by medical students, residents, fellows, and whatnot. They're like, Dr. Allo, I'm not really sure how to bring this up with my patients. How do I bring up the topic of weight loss? So there's a few different ways to do it, but nothing beats just being straight up. Like, I'll be asking my questions to my patients, like, have you had any chest pain? Have you had any shortness of breath, lightheadedness, dizziness, passing out, heart racing, anything like that? Weight going up, weight going down, any changes, just like that. Or like, have you quit smoking? You still smoking? And a lot of times I know the answer to the question because, you can smell the smoke. But same thing with weight loss. You know that they're overweight, or maybe they're not overweight, but you don't know if they've changed weight. Like, if they've lost 60 pounds but still got like 30 or 40 to go, you may not be able to tell right away. So you want to try to ask it in a nonchalant way that's not judgy. So, as you're asking your questions, one of them can be, has your weight gone up or down? And are you trying to lose or not? Similar to like smoking cessation. Have you quit smoking or not? And are you trying to quit? A lot of patients will just tell you straight up, I am not trying to quit smoking right now. Some patients will tell you, I'm not trying to lose weight. I like the way I am and I'm happy with it. Well, that's fine. They don't want to broach the topic. But too many times, and the reason I bring this up is too many times in my clinic, I've had a patient just start bawling and crying and in tears and just say, you know what, Dr. Allo, you're the first doctor that's ever told me I need to lose weight, or has even brought up the topic of weight loss. I've had multiple patients just like start tearing up, getting super emotional, just tell me, you know what, you are the first doctor that's ever brought this up with me. No one has ever told me I need to lose weight. And look at me. I clearly need to lose weight. So don't be embarrassed or shy. This is not like an embarrassing topic to your patients. A lot of doctors, especially young ones or new doctors, are like, you know what, I don't want to bring this up. It's a sensitive topic. Imagine if somebody starts talking to me about weight loss. Like if you're a younger physician or health practitioner of any sort, you are self-conscious and insecure of your own weight or your own body image, or you have body dysmorphia to a certain degree, and you're concerned that, well, I would hate for somebody to bring it up for me. I know I'm overweight and I know what to do. Why would I want to bring this up for my patients? So don't feel that way. Your patients actually want you to bring it up. They want you to address their problems. Their biggest problem right now, for the vast majority of patients, the number one problem, other than smoking, because not that many people smoke anymore, the number one problem now is actually obesity. So one of the best ways to bring it up is very nonchalant about it. And you know what? A lot of patients are going to appreciate it, and you're going to be surprised and shocked that more people appreciate that you brought it up than not. If you would have just ignored it or brushed it under the rug or not even said anything, a lot of patients would be like, that's kind of weird. He talked about my blood pressure, my cholesterol, my diabetes, but not this one thing that affects all of those, which is my obesity or being overweight. So definitely do that. Another thing you'll hear a lot is when you actually start counseling patients on proper weight loss and the correct form of weight loss without these restrictive, crazy diets and all this stuff you see online, you'll have patients be like, you know what? You're the first doctor that talked to me about weight loss in a way that makes sense, in a way that doesn't sound like too crazy. So definitely you need to get in the right state of mind first as a physician or a health practitioner of any kind. You need to get in the right state of mind on how comfortable you are with your weight and then how you are talking to people about it. Getting in the right frame of mind is super easy. I have like a free mindset course below you can click on. Plus, highly recommend reading my book. It brings up all the science behind proper weight loss, and that's linked below too. The science behind weight loss, so you know what to tell patients. If a patient says to you, well, I tried keto, well, what's your answer to that? Well, I'm doing intermittent fasting. What's your answer to that? Well, I'm doing 1 meal a day. Or I cut out bread, pasta, carbs. I'm cutting out refined sugars. I'm doing a low-fat diet. Like whatever your patients might say to you, you need to have a scientific educated response and an answer to them on what they can do with that. It's not just like, well, I'm doing keto. Okay, fine, do keto. That's great. Yeah, do it. You're going to lose weight. And then they come back 3 months later and they're up 10 more pounds. So make sure you have the data and the knowledge and the background to talk about it comfortably with your patients. I recommend a lot of the resources below. Hopefully you've learned something from this, but do not be afraid to talk to your patients about weight loss. They're actually there waiting for you to bring it up. So make sure you keep that in mind. They want you to talk about this, and please don't be afraid to talk to your patients about weight loss.